Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this one video clip, I will be talking to you about how different is women's heart disease compared to men. Now, we know the heart attack occurs because there is a chronic plaque which was formed within these coronaries. Coronaries are the arteries that are supplying the heart. Now, here are two sets of arteries that are being represented in this right schematic panel. You have a right coronary supplying the right side of the heart as well as the back of the heart. The left divides into two. It supplies the front of the left side of the heart, and then there's another branch that goes to the back to supply the other portion of the back side of the left side of the heart. So the plaques, now look at these arteries in this schematic, and over a period of time these plaques can progress, and when they keep progressing like this, the intraluminal orifice is so critically narrowed that not enough blood is going, and therefore not enough oxygen is available to the heart muscle tissue. And as a result, that suffers ischemia or an infarct, as we call it, a heart attack. So more so, the heart attack occurs when there is a rupture of the plaque or an acute thrombus develops. In other words, now the flow through this orifice is so sluggish that even the blood coagulation factors, including platelets, fibrinogen, etc., they start accumulating over a period of time and completely shut off the flow, or there is minimal flow through this vessel. As a result, this area suffers an acute damage, and that results into a heart attack. So that's the philosophy, that's the pathogenesis of a heart attack, and that's how it progresses, whether it's in men or in women. But in women, the presentation is much different and their outcomes are much different. So let's understand the difference here. So we know the heart disease in women presents much more differently. And how differently? Well, they do not have as often a chest pain, the classical chest pain that the men would have. Remember, we talked about how the heart attack in the men present with left-sided radiation to the arm, pressure, tightness, and they'll have breathing difficulty. And the whole episode may last about 45 to 60 minutes, depending upon how severe the heart attack is. Very infrequently, they'll have other symptoms. But in women, the predominant symptom is upper abdominal discomfort, nausea and vomiting, lightheadedness, and more sweating than men. So these are the symptoms that develop more often in women than in men. Not that the chest pain may not occur in women. It may, but the incidence is lessened. So that's the first difference. The second difference is the risk rises sharply after the menopause. In other words, the women tend to be protected up to the age of 45 or 50 because of their estrogen protection we talk about, because of the ovarian function that's preserved until the menopause. Once the estrogen declines rather abruptly after the menopause, the plaque formation speeds up. And that's because of the LDL-HDL ratio going adverse in its components. In other words, we'll have normal HDL or higher HDL and less LDL in the premenopausal stage. But the moment the lady or the woman goes into a menopause, the HDL drops and the LDL increases. As a result, the plaque formation will be rather very abrupt. So that is another noteworthy point, that after the menopause, after the age of 50, one should take these symptoms when the woman is presenting in the emergency room very, very seriously. And they cannot be dismissed, and they cannot be ignored by the fact that they have some upper abdominal indigestion, etc., even though the symptoms are very suggestive of indigestion. But it should not be taken lightly, and they should undergo an EKG in the emergency room or at the doctor's office, and immediately somebody should be able to pick that up, that there is a heart attack process is ruled out or ruled in, depending upon what one sees on the EKG and the blood tests. In the first year also, now after the heart attack, after post-MI we call it, in the first year after the heart attack, the women have 50% more likelihood to die than men. Now that is also very significant. In other words, the mortality is higher in the first year after the women have had a heart attack as compared to the counterparts men. And as age goes by and they have had the first heart attack, 5 years later, when you start to see those subset of groups, the women are twice as likely to have a second heart attack than the men. So the protection is lessened, and even far lessened, as after the heart attack. So they are very prone for repeat heart attacks. They are prone for mortality is being high, and then obviously the risk is high, very high soon after the menopause. Their presentations are different, and of course up until the menopause they are protected by their estrogen that circulates, but that should not be taken as a protection forever, because soon after menopause, because that's when their risk rises rather very, very rapidly. Hope I've been able to define the differences between the men and women in their heart disease presentations and their outcomes. Stay tuned for more interesting subjects later on. Thank you for your attention.